You survived the go-live. You spent the capital, endured the massive implementation process, and finally got Epic up and running in your practice. Epic is everywhere. It controls 38% of the hospital market and houses 250 million patient records. 2 years after launch, most mid-size practices use only a fraction of what this system can actually do. Physicians are losing over 20 hours a week to indirect patient care and administrative tasks like order entry, documentation, and inbox management. Passive operation transforms an expensive EHR asset into an ongoing administrative burden. The direct financial loss occurring inside the billing cycle creates a penalty even more significant than the lost time. Practices leave 11.4% of total revenue on the table, 13.3% undercoded, and 7.4% overcoded. For a practice generating $3 million annually, this equals $342,000 in avoidable leakage. Smaller independent practices lose $30,000 to $50,000 every year from missed charges. This happens because optimal workflows get skipped. Staff manually enter data that Epic could flag automatically, and automated charge capture triggers sit ignored. This phenomenon is known as workflow drift, the slow daily deviation away from established best practices. This continuous revenue leakage represents a predictable failure of clinical operations management. The primary engine driving workflow drift is the constant churn of front office and support staff. Medical groups across the country currently face a staggering 40% annual turnover rate for front desk staff and medical assistants. Every time a staff member leaves, the practice's institutional knowledge of custom macros, smart sets, and reporting shortcuts is erased. Replacing just one of those roles costs between $9,000 and $12,000. That excludes the weeks of lost productivity while the new hire learns your specific Epic build. Relying on the traditional in-house hiring model forces a practice into a self-perpetuating cycle of retraining. Under these conditions, the system can never reach peak utilization. The most profitable practices are changing their approach. Instead of expanding their local headcount, they are extending their teams virtually. They partner with Staffingly virtual Epic assistants, Epic-certified analysts who manage daily operations like registration management, order entry, charge capture, and report generation. These remote teams integrate directly into the practice, operating under strict HIPAA, SOC 2 Type 2, and HITRUST certifications. This model also integrates AI tools to handle high-frequency tasks in the background. These algorithms actively scan for duplicate records, flag likely missed charges, and enforce documentation standards before a claim ever reaches the billing department. Pairing certified human oversight with AI automation creates an operational environment that improves over time, permanently breaking the cycle of workflow drift. Comparing an in-house hire to a dedicated virtual model reveals a significant financial gap. This chart illustrates the difference. When you factor in salary, benefits, training, and turnover, a single in-house employee becomes a $60,800 annual burden. The Staffingly dedicated model costs $21,600. This 64% cost reduction yields $39,200 in direct annual savings per position. This operational savings is in addition to the $30,000 to $50,000 recovered annually by plugging the daily charge capture leak. The onboarding process is frictionless. The service deploys in 48 to 72 hours, backed by a 2-week risk-free pilot. Securing the full value of an Epic investment requires dedicated operational oversight to finally capture the revenue promised during implementation.